We're joined by Dr. Ed Brown, who's president of the ATA and CEO of the Ontario Telemedicine Network. Thanks for joining us. A busy year for you. You're completing your first term. Tell us, how has the Affordable Care Act impacted the ATA and how is telemedicine used overall?
Well, I'd say the Affordable Care Act hasn't had much impact yet. It's kind of had a slow start, as most people know, but clearly, once there's up to 50 million new people that are insured, it's going to have a huge impact on the healthcare system. I think telemedicine will be very relevant, for a number of reasons. Number one is access. How are we going to provide access to care to all those folks? And certainly telemedicine is a tremendous way to improve access in rural areas, but also used within physician practices and other practices to really empower healthcare providers to deliver care in a team-based situation, which really will increase the amount of healthcare people can receive. So that's number one. And then number two, of course, is the big problem that we face right now, and that really all healthcare systems in the Western world face, is chronic disease.
Right.
5% of the population accounts for 60 to 80% of healthcare costs, and certainly telemedicine is a key enabler to that solution.
Last year when you were at the conference, you talked about the importance of removing barriers to make telemedicine more readily accessible. What strides have you made in the last year?
Well, I wouldn't say that I made strides, but certainly the country's made great strides, and really, at every level, there's been quite a bit of federal legislation. One of the really exciting pieces of the puzzle was legislation that enabled federal providers to provide care across state lines, regardless of what state they're in. At the state level, there's really been a lot of legislation. There's currently over 30 states with some kind of legislation passed or in motion around telemedicine. Groups like the Federation of the State Medical Licensing Boards have been very active developing telemedicine policies, looking at ways to solve the interstate licensure problems. So, very, very active. I think from ATA's perspective, we've also been working with a lot of other organizations. So we're a very collaborative group. We've reached out to literally dozens of other national organizations to partner, work together to advance the cause.
You've had a lot of success in Canada. What advice do you have for folks here in the U.S. to making this better?
Well, there's no magic to telemedicine. It's really a technology. It's a solution to a problem. So I think the key thing is to look at the problems and see where telemedicine can solve them. Telemedicine's all about, improving value for money, improving the quality and access to care. We have lots of those problems across every health system, and I think telemedicine needs to be part of the solution to that.
One quick thing before we go, you're excited about your new logo, are you not? Tell us about that.
I am. I noticed you have our old logo here. That's been ATA's logo for almost 20 years, and at this conference we're liberating a new logo. I hope people like it, but it's not just a logo, of course. The logo represents where we're going and where we've been, and certainly the logo is modern. It represents not just the satellite technology that you saw in this original logo, but certainly all the technologies, all the exciting wireless, mobile, internet-based technologies that are out there. So we're expanding that tent, and also really trying to communicate to companies out there, to planners and health systems, that telemedicine is a bigger tent. Everybody needs to be part of it, and that's really what that new logo means.
All right, Dr. Edward Brown, ATA President and CEO of the Telemedicine Network in Ontario. Thanks for joining us.
My pleasure. Thank you.